Hello, and welcome. Welcome to our channel. Here you will find diverse content on the most varied topics of health and types of diseases that affects humanity. Our team is always committed to bringing relevant information and quality entertainment to our viewers. Our goal is to be a learning and informative space where you can feel comfortable exploring our content and expanding your knowledge. Therefore, do not hesitate to leave suggestions and comments in the videos. Your opinion is very important to us. We hope you enjoy what we have prepared with such affection for you. Breast cancer is a type of cancer that affects the breasts, causing symptoms such as the appearance of nodules and changes in the skin and nipple. The disease has treatment, and one can achieve complete cure of the patient, especially the one with an early diagnosis. Among the treatments available for cases of breast cancer are chemotherapy, radiotherapy, and surgery. The ideal treatment for each patient will depend on aspects such as the type of cancer and the staging of the disease. Breast cancer in Brazil, according to the National Cancer Institute, INCA, is the most common in women when non-melanoma skin tumors are excluded. What is breast cancer? Breast cancer is a type of cancer that affects the breasts. We can define cancer as a group of diseases in which disordered cell growth is observed, leading to the formation of tumors, which can invade tissues and organs and even spread to other regions of the body, metastasis. Breast cancer affects both women and men, however, in men, it is a rare condition. According to the INCA, breast cancer in men represents only 1% of the total cases of the disease. What are the risk factors for breast cancer? Some risk factors are recognized for the development of breast cancer. Among them we can highlight age, obesity and overweight after menopause, sedentary lifestyle, first menstruation before 12 years of age, not having had children, first pregnancy after 30 years of age, menopause after 55 years, use of hormonal contraceptives, performing hormone replacement, and cases of ovarian and breast cancer in the family. It is worth noting, however, that the presence of one or more risk factors does not necessarily mean that women will develop this type of cancer. What are the signs and symptoms of breast cancer? Breast cancer initially does not cause symptoms, which can hinder early diagnosis. Some breast changes, however, may indicate the disease, so it is critical that people take special care of their body, always observing and seeking medical help if changes raise suspicions of any illness. The National Cancer Institute highlights as signs and symptoms of breast cancer that deserve attention and should be investigated by the doctor. Emergence of lump in the breast, breast with reddish skin, retracted or orange peel aspect, changes in the nipple, nodules in the armpit and neck, spontaneous output of abnormal fluid through the nipples. Does breast cancer have a cure? Breast cancer is a disease that presents cure, especially when early diagnosis is made. Treatment varies from one patient to another and will depend on factors such as the type of tumor presented and the stage of the disease in which the patient is located. The faster the treatment begins, the more chance of cure it will present. Among the treatments available today, we can mention surgery, radiotherapy, chemotherapy, biological therapy, and hormone therapy. Can breast cancer be prevented? Breast cancer presents as risk factors some life habits that can be modified, such as maintaining a healthy diet, practicing physical activities, thus avoiding sedentary lifestyle, not to make use of alcoholic beverages, avoid the use of contraceptives as well as the so-called hormone replacement. Breastfeeding. How is breast cancer diagnosed? Early diagnosis is essential for greater success in the treatment of breast cancer. Both men and women should always observe their bodies well to identify changes that may indicate a disease. In addition, the woman should make routine consultations with a gynecologist, who will evaluate different aspects of her health, including the breasts. Tests that can help in the diagnosis of breast cancer include clinical examination and imaging, such as ultrasound and mammography. The Ministry of Health recommends that mammography be performed by all women aged between 50 and 69 years every 2 years. It is worth mentioning that the aforementioned tests help in the diagnosis, however, after the verification of a tumor, the confirmation of the disease is only made after the biopsy. So, did you like the content? So if you're looking for a channel that makes you think, inform and learn, sign up now and follow our updates.